So in this video, we are going to discuss different types of DPIs. So the first one we're going to go over is the Asthma-Nex Twisthailer. It has, where is it? It has a counter. So this indent here points to the counter. There's one left. With this one, you want to twist it until you hear a click. And let's see, maybe you might be able to hear it on the video. So you grab the bottom part and you click it, and as it clicks, the top comes off, so it pulls straight up. So you want to make sure that when you are instructing how to use a DPI, that you tell your patients they need to hold it level, because if it falls, the medicine's going to fall out and they're not going to get the required dose. So then they blow away from the DPI, exhale, make a tight seal around the mouthpiece, and inhale slowly but forcefully. Because remember, they have to generate a flow of 40 to 60 liters. Okay. Another common DPI is the discus. Not just Advair, some long-acting adrenergic bronchodilators also come in discus form. So the 50 on the Advair represents the dosage of the corticosteroid, and the 50 represents the dosage of the LABA. So you can see the dosage counter here. So with the Advair discus, you're going to put your thumb in this hole and slide this piece to the side. And then what you're going to see is this. So you have the mouthpiece here, and you can see the mesh that we discussed in lecture that helps separate the propellant from the medication itself. And then you have a lever here. So the dosage says 37 right now. So they put their finger and their thumb like this and click that lever. Now, if they don't hold it straight, and I like to say hold it like you're eating a sandwich or a hamburger, if they don't hold it at level like this, let's see if you can see it, then the powder falls out. And this is just a sample. It's not a real drug. So we're not wasting any real medication. And then again, you want to have them blow to the side. It's really important, especially with DPIs, that you don't exhale into the mouthpiece, because that's going to create moisture and humidity. So then you can see the powder on the mouthpiece. If it gets wet, it's going to clump and the patient is not going to get the adequate dose. So after they take their medication, so if they feel like they just didn't get enough big breath to do the entire dose, they can take another breath with the DPI, as long as they're holding it level and they haven't dumped any of that medication out. And then to close it, you just take it from here and slide it back. And then the counter is down to 36. The expiration date is on the back, so make sure that they're checking the expiration date as well. Okay, so this is, I would say, probably the most common. Advair and Spiriva are probably the most common DPIs that you will see. So a lot of times you'll hear people refer to this as their egg. So you can see, because it's got that egg shape. So it opens on the top and the mouthpiece is here. Let's see if I can get a close-up shot. It's really hard to see, but the mesh, this is better. So this is the mesh here that is going to separate that propellant from the drug. So with Spiriva, you're going to put your medication in here. So these two, the Advair and the Twisthailer, are already preloaded. With Spiriva, when you're at the hospital, a patient will have their own egg, but what you need to pull out of the Pyxis are these pills. So you'll get one blister, and Spiriva, remember, is an anticholinergic, is Q day. So that means once a day. It's usually in the morning. Every once in a while, you'll have a patient who likes to take it at night. So it comes in this little capsule. You'll load it in here. Close the lid. And then instruct your patient to push this green button. Now, just a tip that I learned the hard way is a lot of times patients will want to crunch their own pill in their Spiriva. So if you load it and then crunch it, some, especially the little old men, get really mad, like you didn't really do it. It's not, they're not getting the real dose. They like to hear that crunch. So let's see if you can hear it. So it crunches, it pops a hole in that, and then they breathe in, and you can hear the flow generated. You'll be able to hear that capsule moving around. Let's see. So you can see, hopefully, you can see where it punctured that hole, so that if there was medicine in here, it would come out once they generated that flow. So that is Spiriva. Another pre-loaded DPI. This is a form of albuterol, so it does come in DPI. The counter's on the back like a typical metered dose inhaler, but when you open this cap, you can hear it click, and that's how you know that the dose is loaded. So you can hear that click. So you exhale away and then take that big deep breath in. And that is an albuterol DPI. So remember, it's not recommended for kiddos who are 6 and under. They need to be able to follow instructions. Your patient needs to generate the proper flow. So these are really good for adults and older pediatric patients.